It's time for transformational change in the healthcare system in Canada because the patient is actually getting lost in the middle of this discussion. What's best for the patient is best for the system. And this transformational change begins with thinking about how can we improve the lives and the impact of the patients that actually access the healthcare system. Whether it's us as a pharmaceutical company, whether it's the government that actually pays for it, or whether it's the physicians that provide those services, the best interest of the patient and the best outcome of the patient has to be the number one concern in order for the system to maintain its sustainability and to improve its productivity and its return on its investment. At Sanofi Aventis, when we look at the challenge of the healthcare system in Canada, we realized that we needed to take a leadership position. And by taking that leadership position, we're putting the patient in the center of all of our discussions with all of our stakeholders, whether it's government, whether it's physicians, whether it's patient groups themselves or other payers. We're really focusing on what's the best outcome for the patient. Our products will come as a natural result of that discussion. It's not product first, it's patient first. And that's going to take some time to actually take hold in the marketplace. We believe that that's demonstrating leadership to change the debate. So the way the Canadian government is set up now to handle management of healthcare, it's usually done in silos. So there are groups that measure the pharmaceutical piece, there's groups that measure the physician costs and the hospital costs. The first thing that has to be done is you have to break down those silos and look at the total cost of care. But the other side of that is you have to look at the societal impact of innovation. Can I actually bring Canadians back to work earlier? Can I make them more productive? Can they actually be with their families and have a longer length of life, which improves quality of care? These things have to be taken into consideration in the discussion, not just the component cost of that innovation. When we look at the healthcare system in Canada, innovation is not respected or valued, and the reason for that is because we're facing a significant challenge in the sustainability of the healthcare system. So when faced with that challenge, payers, whether it's governments or private payers, are resorting to easy tactics. And when I refer to easy tactics, it's cost management. As opposed to embracing the opportunity what innovation could do for the overall well-being of patients, it's easier to focus on how do I manage my cost today without picking my head up and realizing this management of this cost today can actually impact the sustainability of the system over time. Innovation has to be rewarded and has to be measured and has to be part of the solution.